Hello, my name is Alexis Friskel, and today I will be presenting on political competency and advocacy in nursing for our Issues and Trends in Nursing course at Fort Hays State University. Being politically competent as a nurse has become a required part of our skill set. As we develop and strengthen our ability to provide the best patient care, we should be looking around asking ourselves how we can improve our working environment and optimize this care and ensure efficiency. Now, I'm not saying that the comic I have here is accurate, but it does allude to the idea that politicians don't often have a background in healthcare and therefore cannot always understand the needs of patients and healthcare workers. As the role of the nurse evolves, we must recognize that nurses will play a pivotal role in helping politicians with no healthcare background with what changes are needed to improve patient care and outcomes. A lot of us nurses are not confident in our understanding of health policy and competence, and it is important that we create ways to foster this so that we can continue to advocate for appropriate changes. To revisit history, in Florence Nightingale's day, nursing's focus was more strictly related to bedside care. However, she went to incredible lengths to advocate for reform that helped create modern nursing as the world knew it in the 19th century. She networked as high up as Queen Victoria and Prince Albert to advocate for better public health standards. According to Solanders and Crane, she believed in autonomy for nurses for the specific purpose of being able to advocate for their patients. Also in history, we have Dorothea Dix, who was a crucial advocate in the advancement of mental health nursing, and Clara Barton, who was on the front lines during the Civil War. She founded the American Red Cross and advocated for veteran benefits after the Civil War was over. I also want to mention that more currently, we do in fact have nurses in Congress. However, we only have two. Edie Burnick Johnson has a background in mental health nursing and public administration. And Congresswoman Lauren Underwood is the first woman, person of color, first millennial, and youngest African American woman to serve in the U.S. House of Representatives. The Institute of Medicine, or IOM, acknowledges that the Patient Protection and Affordable Care Act has been the most significant change in healthcare in the U.S. since the 1960s, when Medicare and Medicaid were created. That being said, the report explored in part how the ACA affects nurses and what they can do to help optimize healthcare today and beyond. They presented a list of recommendations that have now become national and state initiatives among nursing coalitions. One of the wonderful outcomes of the Future of Nursing report has been the formation of Campaign for Action, which is aligned with the Robert Wood Johnson Foundation and the AARP. They have developed action coalitions in every state and in Washington, D.C., and collaborate with a variety of groups, including policymakers, to advocate for these initiatives. Their website is very user-friendly and to me is a great way to stay up to date on current national nursing initiatives. They have easy-to-read charts with statistics on the progress of each campaign. They emphasize that nurses are partners in healthcare and provide an essential role in the ever-changing future of healthcare. Your own state action coalition will be another great resource to stay in the know about nursing issues and if you're interested in becoming involved. My own state, Kansas, has the Kansas Action Coalition, which has 4 teams that work toward meeting the recommendations put out by the Future of Nursing report. They state that their goal is to ensure high-quality patient care for all Kansans. They offer report findings from their surveys and even offer mentoring for nurses and frequently host webinars. The demographics in the U.S. are changing rapidly. People of color make up the fastest growing part of our population, yet they tend to face the greatest amount of disparity. A large majority of Americans are also entering senior age, and chronic disease and comorbidities also continue to rise. Combine any of these issues or add on a disability, and one can easily see how complicated and expensive this can become. According to Salman and Echevarria, the greatest challenge is figuring out how to pay for the services and care that our largest evolving demographics need. Our ever-changing society paints the picture that a lot is ahead of us and that we as nurses must be in the know on how to anticipate needs and provide quality care. Again, we are expected to contribute ideas and experiences from the front lines on how to be more proficient with care in these circumstances. Over the past few years, it's been difficult to know exactly where the Patient Protection and Affordable Care Act stands, but for now, it's still in place. I wanted to briefly go over its history and goals. According to Salman and Echevarria, this major transformation in healthcare was passed into law in response to rising issues in healthcare, including the changing demographics I mentioned on the previous slide, and the high cost of healthcare and the poor quality of healthcare. Nursing is affected by each of these listed provisions here. Despite the potential for change within this act, healthcare and patient populations are changing, and nurses are at the front lines of this. But if you would rather step aside from the ongoing debate that is healthcare reform, there are a host of other nursing issues that are an important part of health policy. Ways to enhance political competence includes registering to vote and being an informed voter. Deciding on a resource or news outlet to keep up to date on nursing issues is another way. You can also join the American Nurses Association or simply sign up to receive updates on issues or find ways to advocate from their website. Or you can join your own state nursing organization. In following ANA or the Campaign for Action, though, which we did cover earlier, you're able to follow current initiatives and be more aware of how they are making their way into your own work environment. Rue and Halstead assert that the best way to learn political competence is to be immersed in the issues in order to understand how to make change. To conclude, we are aware that the registered nurse's role is changing and that new expectations include furthering our education and becoming politically competent in the process. This is in part so that we can collaborate with policymakers and other healthcare professionals to provide the best outcomes for our patients. And we've gone over several ways to work toward gaining political competence, and I'm listing here a few of the mentioned organizations once again. I thank you for listening today. I hope that you have a little more clarity on why it's so important to develop political competence and become a nurse advocate. Thank you for listening.